everyone. I'm Dr. Jiji Chandran, a homeopathic physician practicing in Chennai. Just when the country is returning back to normalcy after the COVID situation, we are now seeing another illness that is rising at an alarming rate. Dengue, or dengue as it is commonly called, is now being reported in many parts of our country. Tamil Nadu alone reported more than 4,000 cases of dengue in November, and similar cases are being reported from other states. Sometimes we see that even the mild cases are progressing into complications, and often we lose a life to dengue. I believe it is because of our ignorance in failing to identify the signs and symptoms at the earliest and seeking medical attention. In this video, we will go through what is dengue, what are its signs and symptoms, and how it can be managed. Dengue fever is a very painful, debilitating, mosquito-borne viral disease which is spread by the bite of the Aedes mosquito species. According to the WHO case definition, a person is suspected to have dengue if they present with sudden high fever and two or more of the symptoms that I am about to mention. The first symptom, the patient presents with very severe headache, especially in the forehead. The second symptom is retroorbital pain or pain behind the eyes. The third symptom, arthralgia, which means pain in the bones. Now, dengue is also known as break bone fever. So you can imagine the intensity of the pain that the person suffers from. It is as though their bones are being broken. The fourth symptom is myalgia or muscular pain. The patient presents as body pain, severe body pain. The fifth symptom is rashes. Some people develop rashes which usually begin on the third day and they remain for about 2 to 3 days. Another symptom is bleeding. Some people develop mild bleeding, especially bleeding from the gums while brushing their teeth, bleeding in their stools, and some people also bleed into their skin. That is, we can see it as small spots of blood or hemorrhage under the skin, and this is known as petechial hemorrhage. Some people also present with nausea and vomiting. Now, if you identify such symptoms in yourself or people around you, immediately seek medical attention and go in for a blood test, which will help you diagnose the condition and recover at the earliest. The symptoms of dengue can be mild or severe, and the mild symptoms can be easily managed at home. In any medical condition, the general management is as important as the medical management, and most often we do not realize the importance of general management. In some cases, proper general management alone is enough to get a person back to normal or to save a life. Here, I will suggest a few general management tips that you can keep in mind. The first important thing is to ensure the fluid intake of the person. As we all know, when a person is affected with dengue, the platelet counts start decreasing. When the platelet count decreases, it affects the blood volume decreases, and it also causes alteration in the blood pressure of the person. So we should ensure that the person is given adequate amounts of water. Water in any form, be it plain water, you can give them juices, any fresh fruit juice, lassi, buttermilk, and tender coconut. Tender coconut water is loaded with electrolytes, and that is very effective to beat the fatigue that comes along with dengue. So fluid resuscitation is the most important step that we need to follow. The second important thing is our diet. Along with medicines, if we follow a proper diet regimen, we can easily recover from any sickness. In dengue especially, we need to take food that helps in the build-up of platelets. And folates and iron play a very important role in building up the platelet count. Green leafy vegetables, nuts, seeds, and legumes are a rich source of folates. Iron is found in green leafy vegetables, red meat, pumpkin seeds, beetroots, etc. Vitamin C also plays a very important role in fighting infection and also in absorption of iron. All citrus fruits, guava and gooseberries are rich sources of vitamin C. Papaya leaf juice has also proven to be beneficial in treating dengue because it helps in the buildup of platelets. Papaya leaf contains a phytochemical called acetogenin that is proven to be effective in increasing the platelet count and also in reducing the symptoms of dengue. These are very simple general management tips, if followed, can prevent a case from going into serious complications. Now talking about medical management. Homeopathy has proven to be quite effective as prophylactics as well as a supportive treatment in dengue. If you suspect you have dengue and are showing signs and symptoms of dengue, do consult a homeopathic physician near to you and seek attention at the earliest. Trust homeopathy, stay safe and stay healthy. And I hope this video has been informative to you. Thank you.